Thank you so much. It's an honor to be here. Thank you, Shasu Labs and Invitrx. It's my first time in Pakistan. I hope this is not the last one. So, I'm an anesthesiologist by training, and I've been practicing regenerative medicine for the past 10, 11 years. I'm going to talk a little bit about exosome therapy. I'm going to do a little bit about stem cells. I combine therapies at my practice. And at the end, I'm going to give you some tricks that I use in my clinic, enhancing both therapies.
Just a question for my audience.
Sure.
And he also said stem cells and exosomes separately. Can you tell us what is the difference?
Okay, I'm gonna go through that slide later on, but the easy way to explain to my patients is that exosomes is a little piece of the stem cell. There are little particles, proteins is what I usually explain to them. The cell has DNA. The exosomes, they don't have a DNA. Okay, so as we age, tissues and functionality, they do decline. And we do have the capacity of regeneration, but then as we age, it declines. So here, this is the simple way also to explain to a patient. There are two types of stem cells, which I started my practice years ago using autologous because we couldn't reach the allogenic stem cells. Ever since 2017, I started using allogenic stem cells. So allogenics, they come from another human. In our case, an umbilical cord. So there are other areas where we can get either autologous or allogenic stem cells. We have fat, endometrium, bone marrow, dermis, dental pulp, breast milk, amniotic fluid, and placenta. I'm very familiar with bone marrow and fat, which were the first ones that I was using in my practice when I was using autologous. A little bit painful, even though I use a lot of anesthesia with patients. And nowadays, mostly umbilical cord. And here we have, this is where we usually use the exosomes and stem cells. This is the Wharton's jelly. This is the jelly that surrounds the blood vessels. Years ago, we started using cord blood stem cells, but nowadays it's just the Wharton's jelly. And now going back to the exosomes. So exosomes, as I was saying earlier, they're like little pieces that they come from the cells. They're tiny vesicles. They leave the cells. This is the way that cells communicate with each other. They're taken up by other cells. That's how they communicate, and they're very rich in proteins, and it's a cell-free therapy. So if a patient asks if there is the possibility of cancer, which there is none, not even with stem cells, there's not documentation in the literature. So it's a cell-free therapy. As Mr. Habib was saying, the classification of the exosomes, it depends on the size and the mechanism and the function. So there are microvesicles or ectosomes. There are the exosomes, which they measure between 30 and 150 nanometers, and then the apoptotic bodies, which are usually larger. It's very important as physicians when we get a rep coming to our practices saying that they do have exosomes. This is a very important question because sometimes what I have seen throughout the world is that they do sell apoptotic bodies as exosomes, and usually they are cheaper as well. So we want to ask that question. Okay, so what do they have on the inside? They have so many proteins, but this is like a good example. I'm not going to go through all of them, so don't worry. So pretty much they have cytokines, they have growth factors, signaling lipids, and messenger RNA. This is another image, which every single day they discover more and more proteins that are inside of the exosomes. And this is what I was talking earlier, the components, the cell components versus the exosome components. So if we go one by one, they have the messenger RNA, they have the microRNA, they have proteins and growth factors, but the only difference here is that the cell has DNA and the exosomes, they do not have a DNA. So as I was mentioning, they communicate between each cell so they can modify target cells and organ functions so they can regenerate tissue. There's no acute immune rejection and there's no tumor formation. Okay, so some practical things for exosomes. It is not a cell. They can induce cells to regenerate and repair tissue, so they can create new tissue, cartilage, bone, nerve, skin, hair follicles. They cannot differentiate into other cells. They are not perceived as foreign bodies. They do contain messenger RNA and growth factors. And they do cross the blood-brain barrier. And I think this is something very important in case you have a patient with, let's say, brain fogging or certain neurological conditions, because when I started using cells, the only way to get into the blood-brain barrier it was by doing intrathecal injections. I'm an anesthesiologist by training, and I'm an interventional pain physician, so this is my territory. So we used to do intrathecal injections. But now with exosomes, since they're so little, they can cross the blood-brain barrier, so we don't have to get that invasive. Just with an IV would suffice. And the other important thing with exosomes is that there is this thing with stem cells that they do have this first pass. What does that mean? That the cells, when you give an IV with stem cells to the patient, usually the majority of the cells, maybe 60–70%, are going to go into the lung, liver, pancreas, or kidneys. When you do exosomes, you don't have this first pass. The other thing of the comparing the exosomes with the stem cells, they're very easy to administer, store, and freeze, and they're ready to use. They come in a vial, so you just do the extraction, and that's it. It's not like the PRP, where you have to do the blood extraction, the centrifuge, and then do the injection. And they're very easily controlled because they come in vials, 1 ml, 2 ml, 5 ml, depending on the presentation. And they can be used repeatedly. So you can use them, let's say, a patient comes to my clinic, day 1. If they want another injection the following week, there are no contraindications like steroids. There's another image of exosomes. And this is, I think this is very important because there are so many questions out there asking about the PRP, the stem cells, autologous, and the umbilical cord. So nothing wrong with any of them, but I usually like to offer my patients, what's best out there. And if we compare the charts, umbilical tissue, it's way more robust. If we compare here, we have that PRP has around 25 growth factors, adult stem cells 110, and umbilical over 400. The other thing with PRP, those of you that have done it, it's very acidic, so it's very painful when you inject PRP. So it's uncomfortable to the patient, and then it causes a lot of inflammation. So those are two things that patients dislike: inflammation and the painful injection. Not even when you put a lot of local anesthetic, it's still gonna hurt. When you do adult stem cells or umbilical or exosomes, they have anti-inflammatory properties, and it's not painful because the pH, it's the same. And the PRP, they have minimal anti-inflammatory properties or none at all. As Mr. Habib was mentioning, there is testing, so they're safe, they're secure, but please, whenever you have a salesperson coming to your clinic, ask for the testing. They have to have this type of testing. If not, it's not safe to use the therapy. So this is another part that I really love about the therapy, is that the storage. You could keep your exosomes either in the freezer, ultra low freezer, or refrigerator, or room temperature. If you do have an ultra low freezer, which I know that not many practices have that one, I do have one, they can last up to 2 years. If you have a regular freezer, 1 year, refrigerator, 1 month, and room temperature, 2 weeks. So what's good about this? If you forget your exosomes outside in your clinic and your nurse forgot to put them away in the refrigerator, they can still last. They're not gonna damage. And of course, you don't wanna go have them over 37 degrees because it's gonna be 2 to 3 hours. Okay, delivery methods. I get this question a lot. So because I'm an interventional physician, I can do this type of therapies, but you could do exosomes intrathecal, this is a C1, C2 injection, intradiscal as well. I don't do them that much because they cross the blood-brain barrier. Intravenous, intradermal for scalp. This is a lupus patient. I'm going to show a little bit about her later. And this is a fluoroscopy and use either fluoroscopy or ultrasound. This is ultrasound for medial branch block in the lumbar facet area. This is fluoroscopy. And as I mentioned earlier, safety first. So imaging, I always use imaging, fluoroscopy, or ultrasound, depending on the procedure that I'm going to do with the patient. And this is my favorite area, wellness and using exosomes. So what I've seen and what is documented in the literature, we have seen that there is a relief of chronic pain and it promotes cellular healing throughout the body. So whenever I get the question, why get an IV of exosomes, which is an easy way to apply them, it's because we want to promote cellular healing. We want to decrease the inflammation as well. Those are the main concerns of patients, and those are the main things that we get as we age. Repairs damaged tissue as well, diminishes recovery time and injuries. It's great before and after surgeries. It helps losing weight. It's not going to help directly, but since we decrease inflammation and we help the body regenerate, it helps with losing weight as well. Reverses neurological damage and improves cognitive function and mental clarity. Enhancement. This is my favorite part. I have been working with vitamins for the past. I'm an herbologist, Chinese herbologist, and I trained in 15 years ago actually. So after that, I started using other therapies with patients other than biological therapies, and I found that using very good quality, high doses of vitamins, I've seen a lot of positive results with patients. Even patients with chronic pain, we've been able, just with vitamins, to decrease the pain by a 50% and enhance the wellness. So I'm going to be very quick with vitamins because this can be a whole lecture. But vitamins, there are 13 vitamins that are essential, and the body only produces 2 of them, which are B3 and D. And those of you know that D, everybody's deficient in D. And just a quick tip, whenever we see a lab report, we want to have our patients on D levels of above 100. Why? Because that's the level that is going to help with bone pain. It's going to help with tissue regeneration. It's going to help keeping your testosterone higher, and it's going to keep your immune response higher. Below that, it's not going to happen. And, you can go up to 120, 150. It's not going to be toxic. So the other why we don't absorb vitamins, environmental problems, poor eating habits, and lack of nutrients in the food. So my favorite B's: collagen synthesis, healthy hair, they diminish wrinkles. Please don't use external collagen. It's not going to do anything. I prefer to use liposomal vitamin C if I'm not using intravenous, because liposomal, if it's a good quality, the body can absorb up to 96%. The regular vitamin C that you get in the pharmacy, the body absorbs 20%. So you have to take way higher amounts of vitamin C. D, as I was already talking, and C also boosts the immune system and promotes stem cell proliferation. And deficiencies, it has to do with lifestyle, chronic medical illnesses, nutrient absorption decreases as we age, and a lot of GI conditions decreases the absorption. We also have to take into consideration that medications do affect the absorption, like proton pump inhibitors. They decreases the B12 level. Parkinson's disease medications inhibit B absorption. Diuretics decreases magnesium, potassium, and calcium. And opioids, they can lower vitamin D levels as well. So comparing this in a very simple way, we get that stem cells and exosomes and vitamins, both of them help the immune system. So they also increase the energy levels, self-renew and self-regenerate cells, and vitamins, they do help with cell proliferation, nerve regeneration, decreases body pain in the same way as vitamins, mostly with musculoskeletal pain. Okay, a few clinical cases. This is an 83-year-old male. He fell. He had this compression ulcer. What we did is, with him, we did stem cells. For certain procedures, I prefer stem cells rather than exosomes. But yes, you can use exosomes for this type of patient as well. So we did like an approach of like a trigeminal nerve block, zygomatic under the zygomatic arch, which is in this area here. And we did a weekly protocol of vitamins IV and intramuscular. Also, we used testosterone intramuscular. So in less than 4 weeks, these were the results. Usually those type of ulcers, when you have a patient that is 83, they don't improve that fast. This is not my work, a colleague, but I think it's fascinating. And this was with exosomes, day 0, 7, and day 60. First, second, and third degree burns. You see there are no scars, and you could see the hair is not lost. Usually when you get this type of burn, the hair follicle is dead. And this is a 17-year-old male. He came to my clinic. I did only exosomes. This is just one therapy for exosomes. I do recommend, at least in my experience, using 40 billion vial as a 5 ml vial. I would inject the entire area of the scalp and vitamins as well. And I usually tend to explain to the patient I like to use a shampoo with exosomes as well as the hair serum and a margin of 6 months, and get the therapy every 2 months, give or take. So this is the image here, and with him, of course, vitamins were optimized. Mostly we use a lot of D, C's, and B's, and injectable and oral, and approximately in 10 weeks, we could see the difference.
This is 40 billion?
Just 40, 17-year-old, younger person.
Okay. And do you feel that we can use it in young patients?
He's 17.
70.
Parents consent also. And this is lupus hair restoration. This is a female. She came for cervical pain, so we did stem cells in the cervical area. After she was feeling better, she wanted to do the scalp. I'm not sure if you could appreciate here the lesions that she has from the lupus. So pretty much this is a 12-week difference. Also, we did vitamins and hormones, and you could see the difference in 3 months. And this is something that I did recently. Actually, he's a physician. He came for cervical pain, 67-year-old male, past history of left and CRPS, which we treated 10 years ago. He came with cervical pain, limiting his ADLs. His pain score was between 7 and 9. This was a group of vitamins and supplementation that we did use. I can give you later on the doses if you want. And we did an IV vitamin protocol. When I prepare vitamin protocols, I do them customized to the patient's need. And also we did intramuscular testosterone and vitamin D3. So I do use vitamin D3 injectable and oral, very high doses as well. This was an injection that I did in the cervical area. We do diagnostic medial branch block for cervical pain. It was a positive diagnosis. So then we did stem cell in the facets. And this is the picture that we took the day he got the cells. And this is a picture that we did 2 weeks later. He came and he wanted to have, after his pain was better, he came because he wanted some Botox, he wanted some filler. So we did a little bit of both, and different dates for the Botox and the filler. And this is 2 weeks later. You could see the deposits of fat. He looks thinner in just 2 weeks. This is the AP and lateral views, and he was very happy, pain-free. My favorite beach back home. So thank you so much.